Hi, my name is Danny Thomas. I'm a member at St. Matt's. I am a pediatric emergency medicine physician, and I work at the Children's Hospital of Wisconsin. Sue Swing and Pastor Chris asked me to answer some questions about COVID, so I'm going to try to do some videos answering some questions about COVID. So the first question we had was, what's the difference between COVID-19 and flu? The first thing we'll talk about the similarities. They're both viruses. Flu and COVID are both respiratory viruses that can be spread in respiratory droplets. So you can get a respiratory droplet when you cough or when you're talking, and these droplets can come out of your mouth and you could inhale them and get the virus. It could end up in your hand if you sneeze, and then you could shake someone's hand and they could get that that way. And it could also be on a surface. You could touch that contaminated surface with a respiratory droplet and then get that. Your virus will come into your body through your eyes or your mouth or your nose. And so that's how you would be introduced to both flu or COVID-19. And the way to prevent that is with really good hand hygiene. Just washing your hands 20 seconds with warm soapy water could eliminate both of these viruses, and good respiratory etiquette. So like if you're coughing, to use your elbow, covering up your sneezes, and probably wearing a face mask would be a good way to prevent this from spreading out to the environment. So the differences are pretty important. One, flu is, everyone has had the flu, and so the flu is a very common thing that everyone experiences. The most important thing I want people to take away from this video is that COVID-19, we always talk about it, but when we say its full name, it's novel SARS-CoV coronavirus 2. So the most important part of that is actually the word novel. Novel means new, and new means that this virus is new to every single human being on planet Earth. Nobody has immunity to this virus. So seasonal flu, every year, only 8% of the US population gets infected. Coronavirus or COVID-19 is going to infect 100% of people in the United States. 100% of people could get this virus if exposed to it, because you have no immunity to it. And that's a very, very important distinction, and one I think gets lost in all of this. So the other important thing is talking about mortality rates. So flu has a mortality rate about 0.1%. So 0.1% of people will die from flu. The way they die from flu most likely is that you get mucus plugging, so you get a lot of congestion. That mucus gets into your lungs, it blocks up your lungs, and then you get a bacterial pneumonia on top of that, on top of the flu, and that is what kills you, is that pneumonia. So that's the most common thing that'll kill you during the flu. Coronavirus has a mortality of about 1%. And that's 10 times worse than the flu. And it gets worse as you get older. So the older you get, the mortality appears to get worse by about 1% for every decade of life. So I'm a 40-year-old person. The mortality is around 1%. A 50-year-old person would be around 2%, and so on and so forth. So that's the things that the numbers we would be thinking about. The other thing is that the way coronavirus is causing death is by causing a viral pneumonia, and this is making it hard for people to breathe, causing inflammation in the lungs, and making them feel like they're drowning because they're not getting enough air. And that's why people are ending up on ventilators. The other thing it's doing is it's causing blood vessel injury, which is causing strokes and heart attacks and other problems. And then in some people, it's causing this prolonged inflammation, or in kids, this delayed inflammation that can actually cause the same kinds of strain on the heart, and can cause kids and adults to die. So that's the bad news. So 100% of people can get COVID-19, but the good news is that 30% of people, if they get COVID-19, will be asymptomatic. That's both good or bad news. For the person, that's good news. For society, that's bad news, because they won't even realize they have it, and they'll be out and about spreading the virus. Another 50% of people are going to get it, but have very mild symptoms. Have a little sniffles, but not really have any other major problems. About 15% are going to have severe symptoms where they might need a little bit of oxygen, they might have muscle aches, they might have some other problems. And then about 5% of the people are going to be critically ill, needing a ventilator or having trouble breathing. Do they need prolonged hospitalization? So that's what is happening with the coronavirus. Because of that asymptomatic spread, it is spreading to more people than the average flu would, and because 100% of people are not protected against this because we don't have a vaccine and our bodies don't have this experience. If you are exposed to it, your chance of getting it is very high. So we can do our best by limiting exposure. Wearing masks might be a solution. Washing our hands for sure would be a great way to make sure you're healthy. And those are things that can keep us safe against both flu or coronavirus. Thanks. So the next question that I was going to answer were, what are the 3 most important ways we can prevent the spread of the disease? So the 3 most important ways that we can prevent the spread of the disease are by staying 6 feet apart from people. When we talk, when we are just normally having a conversation, we're letting respiratory droplets leave our mouth. And those respiratory droplets travel the air, but they don't go that far. They don't go more than 6 feet away. And so by being 2 arms lengths away from people, we can actually enjoy their company, but not get them sick. So that's one way we can stop the spread. Number 2, when we are wiping our nose or touching our face, we are either infecting ourselves or getting virus onto our hands. So it's important not to touch your face, your eyes, or your mouth, or your nose. And when you do, you should be mindful of that and be more mindful and aware of when you are touching your face and your hands, your face with your hands. And then you should also be washing your hands. So washing your hands for at least 20 seconds with warm soapy water can be a simple and effective way to eliminate the virus. The virus is actually wrapped in fat. And so a little bit of soap is all it takes for it to just dissolve. And it takes about 20 seconds of good hand washing to do it. So wash this way, make sure you get your thumbs, make sure you get your fingernails, make sure you get the backs of your hands. Simple ways to prevent infection. So that's how you can prevent the spread of infection. The other ways that are important to prevent the spread of infection to other people is if you can't maintain that social distance of 6 feet, particularly if you're indoors for long periods of time, wearing a face mask would be very helpful. It's going to catch your coughs, it's going to catch your sneezes, and it's going to catch your breath and the respiratory droplets. So that's an act of kindness that you can do to somebody else. By wearing a face mask, you're showing them that you do not want to get them sick or infected. And so that's something you can do. And obviously, if you're feeling sick, you should stay home. And you shouldn't go out and about because that is a way to get people sick. So any signs of illness, even mild, because a lot of people are going to have mild signs of illness, should give you pause. And you should certainly avoid going outside if you're feeling ill, other than to seek medical care. And you should certainly wear a face mask if you have to go out because you don't want to get anyone else infected. So the next question I'm going to answer about coronavirus was whether being outdoors or inside makes a difference. And it makes a big difference. You are a lot safer in interactions outside. You are a lot safer in interactions during the daytime in the sun because coronavirus is spread in respiratory droplets. So respiratory droplets are little bits of spit that are invisible to the naked eye that go out into the air. They linger in the air for a few minutes. So inside, when there's poor air circulation, they're just going to kind of hang around there. And so the longer you are in a smaller enclosed space with another person, the more likely the chance that things are going to spread. If you're outdoors, if it's warm, those are all things that are going to keep these respiratory droplets from lingering in the air. They're going to evaporate, and that's all going to make it less likely to spread. So we anticipate summer we're going to be able to spend a little bit more time with our friends and family outside, and we should take advantage of those opportunities because they're probably going to be lower risk. And it's possible that that as we enter the fall and the weather changes, these viruses will sort of come back. If you think about it, this is exactly what happens every year with respiratory viruses like colds and the flu, is that they kind of go away in the summer. The virus still exists, but it just isn't spread as much in that warm air and in the way we're interacting outside. So take advantage of the summer, be outside, enjoy it, because it's likely that in the winter we're going to have to make some sacrifices in being able to do stuff, and we're not going to be able to be outside as much because of the weather, and being inside we're going to have to take a little bit more precautions. So the next question I'm going to talk about is, what are some guidelines for evaluating the risk as public spaces reopen? So I think the most important thing is to think about whether you are going to be able to keep yourself safe. So it is important for all of us to consider the safety of ourselves and our family when it comes to both the spread of COVID-19 and getting COVID-19. And I think that as public spaces reopen, especially because there's not a lot of state level guidance at this point as to what people are considering safe, you do have to sort of judge the risk yourself. And the most important things are whether you're going to be able to stay 6 feet apart from someone, whether how prolonged interactions are going to be in an environment less than 6 feet, whether you're going to be inside or outside, and those kinds of things as things reopen. As we start going to stores and things like that, as long as these interactions are relatively brief, and as long as you can wear a face mask, you're probably more than safe. When it comes to going out to eat and things like that, these are decisions you're going to have to make on an individual basis based on how tolerant of risk you are. I think that there's differences between eating outside and eating inside. There's differences between taking your food to go and having a picnic versus sitting inside the restaurant and being served, and all of those things. The other thing is it's a difference between going to a restaurant that is relatively empty to one that is relatively crowded. All of those things are factors that you're going to have to use to make a decision. And I think that everyone has to decide what their risk tolerance is. But the main thing to always remember is that COVID-19 is a new virus. 100% of people who are exposed to it will get it. What we don't know is whether when you get it, you will be in the unlucky group that gets very sick or in the large group that doesn't really get sick. And that's where the element of risk tolerance that you have to make a decision on yourself by yourself.